Hi, my name is Emily. I'm going to be palpating you today. So the first structure we're going to palpate is the supraclavicular fossa of the clavicle, which is a hollow indent just superior to the medial aspect of the clavicle. To find this, I'm going to start right at the sternoclavicular joint, and I'm going to palpate down the anterior aspect of the clavicle until I find the most inferior aspect of it before it starts curving back up towards the shoulder. So from here, I can move my fingers just superiorly into this hollow indent here, and that would be the supraclavicular fossa. So while we're in this portion, we can also identify the tendon of the short head of biceps brachii. So biceps brachii has two separate muscular heads that converge into a tendon that inserts onto the radial tuberosity. And the function of the biceps is to produce forearm flexion and supination. And since the long head crosses two separate joints, the long head itself will also help with shoulder flexion. So the short head of the biceps originates right at the coracoid process of the scapula, which is a pretty tender bony prominence, so I'm going to be careful when I'm touching it. But to find it, I'm going to put my partner's arm into about 90 degrees of flexion and make sure that it's supinated as well. So from here, I'm going to palpate her coracoid process once more, and I'm going to resist forearm flexion. So you can push up against my hand. And just inferior to the coracoid process, I can feel the tendon of the short head pop out against my hand. You can relax. So from here, I'm actually going to have my partner turn around so she's facing the opposite wall. So if you can just swing your legs around. And from here, we can palpate the spine of the scapula. So the spine of the scapula is located just inferior to the superior border of the scapula, and it serves as a muscle attachment site for the shoulder muscles. So to find it, I'm first going to locate the vertebral border of the scapula, and from here I can locate a bony ridge that's on the lateral border. So that'll tell me that I'm at the spine of the scapula, and I can follow that right to the acromion process, which is where the spine of the scapula articulates with the clavicle. And while I'm going here from medial to lateral, I can also feel the acromial angle, which is where the spine changes direction from going lateral to anterior to meet with the clavicle. And another muscle that we can locate while we're in this view is the infraspinatus muscle, which is located in the infraspinous fossa of the scapula, which is just below the spine of the scapula. And that muscle will insert into the greater tuberosity of the humerus. So to find the infraspinatus muscle, I'm going to come around this way here, and I'm going to put my partner's arm into a bit of abduction as well as lateral rotation. And from here, I'm going to palpate again just under that spine of the scapula, and I'm going to resist lateral rotation, so you can push out against my arm, and I can feel the infraspinatus pop out against my hand when I'm doing that. You can relax. And the final structure that we have to palpate is the serratus anterior, and for this one, my partner has to be lying supine. So can you lay on your back for me, please? The serratus anterior is located right by the lateral aspect of the ribs here, and it serves as an upward rotator and protractor of the scapula, as well as keeping the thorax and scapula close together. So to palpate the serratus anterior, I'm going to flex my patient's arm up to about 90 degrees, and I'm just going to ask her to protract her scapula. So to do that, could you reach towards the ceiling for me, please? Perfect. So that'll protract her scapula for me. And from here, I can locate the lateral border of the scapula, and I'm going to resist her humerus as she's pushing up towards the sky, and I can feel the serratus anterior pop out against my hand. You can go ahead and relax. And that's all the structures you have to palpate today, so thank you very much. We're all set.